fat is a scary word to a lot of women in particular, and we're going to be talking a lot about fats. So I just want to clarify before we talk too much about these fats. These are good fats. This is what our body needs.
Yeah,
fats.
Absolutely.
It's not the stuff that you want to avoid. This is stuff you want to put into your body. Right?
Yes.
So
the whole fats, and I say this in the lecture and presentation, fats is not a 4-letter word.
Right.
Because there are good fats. In fact, the numbers that I'm hearing is that 25% of our body is fat. And if we're turning over just from the cell wall regeneration part of it, the new cells, we would need, as a 120-pound person, we would need 24 pounds of fat. And you need this ongoingly. I think for myself, when I calculate, because you can work it down to a weekly, I think I need to consume 5 or 6 pounds of fat.
Wow.
In a week. So holding, because analogy, holding a pound of butter, okay, well, I need to consume that much.
Wow.
But fat is great for energy, and this is one of the things that we see the themes in a lot of people as they get older and as they do things, lower energy.
Yeah.
And the fats, yes, it's good for building the cells, but the fats themselves, outside of the brain, which would be glucose for the fuel, for the energy,
right,
would be fat for all the other cells.
Okay.
So fat, ideally, not amino acids or protein,
right.
but fats is an awesome form of energy, particularly the polyunsaturated or the essential fatty acids.
Right. And so now that we've clarified that, so that everybody's okay with the word fat and fats, we are going to talk a little bit about that Maasai tribe. I found that really interesting story that you were sharing with me.
Yes.
So,
Maasai tribe,
yes,
what they do with the couple, so the couple is looking to conceive, so they've gotten married. What they do is they make sure that they're drinking grass-fed milk, and of course it's going to be raw milk, and we know we can't get that in the store here, although I do get it, thank you. But they actually feed on that when there's the lush green, they call it the wet season. So it'll make different milk, and for several months before they allow them to conceive.
Right. Now, that being that there is the fats in the milk that are going to support the system, which there's also other vitamins, I guess, and nutrients in that milk that are supporting that whole process of conception, which, we unfortunately aren't getting raw milk most of the time. There are a few people who have access to that. But also there are the other vitamins like A and D and
the fat solubles. Yeah.
Right.
Yeah.
So okay.
Yeah, it would be a valuable piece of the puzzle, and that's how I look at omegas anyway. It's a valuable piece of the puzzle.
Right. Okay. Okay, so as we clarified earlier, we were talking about fats, and this is a good thing. These are healthy fats, and really these are things that are giving us a lot of healthy things, right? It's helping our energy, it's helping our you name it.
New cell development.
New cell development. It's all good for us. What about the opposite? Low fat. We do often hear in society as well, low fat. We're trying to avoid fat a lot of times as well. So low fat scenario. What does that mean?
Well, if you consume a low-fat diet, let's just say, and you're not able to replenish what you're using up, and or if you consume a lot of unhealthy fats,
right?
Some of the things that most people are going to be you're going to be familiar with, is lower energy, poor concentration, right? Other things will be weight gain, depression. That's
funny. Sorry, I'm going to stop. So low fat equals weight gain.
Yeah, the hormonals get all yeah. Weight gain.
Because I've seen that happen to people, but they don't understand or can't conceptualize why, because they're on a low fat diet. They shouldn't be gaining weight.
It's almost like a double whammy.
Yeah.
And they get on a low fat diet, and then they include more carbs, more sugar, maybe more artificial stuff to make it
right
taste good.
Right. Okay, so interesting. So we've got lack of energy. We've got possibly gaining weight. What were the other things?
Lower concentration.
Right.
Lower concentration. Hormonal imbalancing, which we know is another part of the communication system, but really the symptoms that people would, depression. Depression would be the other one, and that's huge.
Okay.
The whole mental illnesses, all of that in the, again, UK, but in the UK I heard them talk about this on the news. The cost of mental illness in the UK is now surpassed the cost for cardiovascular and cancer put together. Wow. This is a hidden area, so I mean, for pregnant women, what they're most susceptible to is the postpartum and the depression,
right.
and even thereafter, which we'll talk about later.
Right. Wow, that's a big stat.